and good afternoon. For our research presentation, we will be analyzing the overall quality of life improvement through treatments of males with obstructive sleep apnea. My name is Oliver Day, and my colleagues are Madeline Elsie, Jocelyn Good, Brian Latta, and Isaiah Tovar. Throughout our presentation, we are going to talk a little bit about obstructive sleep apnea and its implications on the body. We are also going to talk about the purpose of our research and our targeted demographic and some of the case studies we have analyzed and identifying some of the nursing implications. We will wrap it up with an overall synthesis of our findings on the case studies we have analyzed and the outcomes that we have identified during our research. According to the National Heart, Lung, and Blood Institute, they have categorized sleep as a vital function to help aid in overall cell turnover, cognitive functioning, and it even influences how our metabolism is operating. According to the American Heart Association as well, the recommended amount of sleep for adults is anywhere between 7 to 9 hours per night. As vital as sleep is, it is essential for those with obstructive sleep apnea, or OSA, to seek treatments to achieve adequate sleep to function and maintain a state of well-being. Those who do suffer from OSA, whether male or female, have many interventions that are made available to them that are on the market today. But some often are confronted with compliance issues as well as affordability. So for the purpose of our research, we narrowed our focus on a specific group of individuals. Our selected population was males between 30 to 55 years of age with diagnosed obstructive sleep apnea. They are being selected based on their use and compliance of a continuous positive airway pressure, or CPAP machine, and analyzing their overall sleep quality and health status before and after treatment. In order to determine this, we reviewed several quantitative cohort studies in which the prognosis of our targeted group was analyzed. For a better understanding of how sleep apnea works, we deduced it to having a blocked or obstructed airway in which the tongue and soft palate relax and prevent airflow from entering the lungs. The CDC notes that with this condition, the risks increase for hypertension, diabetes, depression, and certain heart conditions if OSA progresses untreated. Currently, there are various treatments on the market and that currently range from traditional CPAP machines, as previously mentioned, to oral appliance therapy and even invasive surgical procedures.
Hello, my name is Isaiah Tovar, and I'm doing the case study slide. The case study was an interview I conducted with a 48-year-old Hispanic male who was diagnosed with asthma as a child, but he was recently diagnosed with sleep apnea. Sleep apnea is a obstructive breathing disorder that is characterized by the soft tissue in the back of your throat typically relaxing and obstructing your airway while you sleep. With this, many people opt in to get a surgery or are prescribed a CPAP machine, as well as other breathing machines to help while they sleep. A CPAP machine is a continuous positive airway pressure machine that it is hooked up and given through a mask while you sleep. This is what our participant was prescribed. However, after speaking further with the patient, he has a non-adherence to this use of the machine every night while he sleeps. A big reason for his non-adherence was comfort. He stated that the machine was too loud and uncomfortable to wear. Continuing to interview this patient, I had informed him of possible complications that can arise with a non-adherence of this medical intervention, such as respiratory and cardiovascular issues. With this, the patient did recognize the risk and started to become more adherent to the intervention.
Hi, my name is Madeline Elsie, and for our search methods, we started off by interviewing our case study patient to learn about their health concerns and their goals. And as mentioned previously, their concern was their adherence to their CPAP machine for their obstructive sleep apnea and what exactly those negative consequences were. And with this information, we were able to develop a PCOT statement and narrow down a population we wanted to focus on. And we also searched reliable databases for our articles, and we synthesized those articles and gathered data that was important to our topic.
Hello, my name is Isaiah Tovar. I'm going to be doing the systemic review and medical analysis slide. The title for the article that we used was Comparative Efficiency of Non-Pharmacological Interventions for Adults with Sleep Apnea, a Systemic Review and Network Meta-Analysis. The purpose of this article was to investigate the cardiovascular risk, work productivity, occupational and traffic accidents, and quality of life associated with sleep apnea patients. The concerns are, what is the most optimal treatment for the disorder? The sample was 197 unique trials, including a total of 15,931 patients, which means the mean age was 51.4 years and 78.9% male. For the data collection methods, it was databases searched include Medline, Scopus, Virtual Health Library, Web of Science for crossover randomized trials on adults that have sleep apnea, as well as interventions used in the cases. The major findings were positive airway pressure was the most effective in improving the health and quality of life of obstructive sleep apnea patients. For the strengths of this article, it comes from the unrestricted literature search, as well as it only includes studies with concrete diagnoses of sleep apnea. The weaknesses of this article are the limitations to this article include small sample sizes as well as short treatment durations.
Hello, my name is Renata, and I'll go over the quantitative study titled Comparing Treatment Effectiveness and Patient-Reported Outcome Measures of 4 treatment options for obstructive sleep apnea. Now, the purpose of this study was to compare efficiency of 4 sleep apnea treatments: continuous positive airway pressure, or CPAP, mandibular advancement device, or MAD, upper airway stimulation, or UAS, and maxillomandibular advancement, or MMA. And they aim to see if there would be a difference to mean disease alleviation, or MDA. The sample consisted of 119 patients from the Thomas Jefferson University Hospital, with 25 receiving CPAP, 27 receiving MAD, 37 for UAS, and 30 for MMA. The data collection methods included doing a retrospective cohort study with the medical records of patients in the Jefferson Health System. The MDA was used to measure the therapeutic effects of each treatment. They used the EBR sleepiness scale, the sleep apnea quality of life index, and a questionnaire over OSA symptoms institute. Now, the major finding of the study was that surgical treatments, MMA and UAS, had a higher MDA versus non-surgical treatment and patients having higher quality of life. In terms of the strengths, they focus on patients receiving one of 4 treatments and included subjective and objective data in their study. They identified the need for further research on how socioeconomic status impacts treatment choice, and explanation on why patients of higher education would more likely receive surgical interventions, as well as the need on the impact of how race affects treatment choice, being unknown due to the low number of racial minorities in the study. Our third article also being a systematic review and meta-analysis titled Effects of Respiratory Muscle Therapy on Obstructive Sleep Apnea, wanted to evaluate the effects of respiratory therapies such as sleep therapy, breathing exercises, and wind musical instruments, for example, to be compared to a control group using the Apnea Hyponemia Index, or AHI, which is used to measure the severity of sleep apnea. They aimed the study to be beneficial for providers in providing patient care, treatment, as well as identifying areas of improvement needed in therapy regimen for sleep apnea management. The sample consisted of 9 studies with 394 participants diagnosed with sleep apnea. How they collected their data was by using Medline via PubMed, Web of Science, EMBase, and Cochrane Library, searching for randomized controlled trials with a placebo therapy or no treatment group. The major findings of the study is that there being an improvement in AHI when compared to baseline for respiratory muscle therapy participants, as well as reported higher quality sleep and reported feeling less fatigue during the day. Some of the positives from the study was the inclusion of information over areas that sleep apnea affected, such as fatigue level and sleep quality. However, they did identify some weaknesses, such as having a limited amount of high-quality randomized controlled trials, as well as there not being enough data on long-term effects of these therapies.
Hi, my name is Jocelyn. I'm going to be going over the nursing implications. So for our primary treatment, we have the positive airway pressure, also known as the PAP. It's the most functional treatment and the most common, but it does require that the patient is adherent and wear it nightly, make sure that the mask fits properly, and sleep on their side. For the surgical treatments, we have the maxillomandibular advancement, also known as the MMA, and it's very effective for those patients who do not have the discipline to wear the PAP and those who are not adherent. But the nurses also need to play a key role in post-op education, pain management, and post-op monitoring to make sure that there's no complications. Some therapies that we can provide to the patient are respiratory muscle therapy and deep breathing exercises, which will help to strengthen the muscles. And then the nurse needs to make sure to educate the patients on the treatments and the lifestyle changes, such as sleeping on the side and being adherent. And then also to monitor progress and support informed decisions. And lastly, the nurse should collaborate within interdisciplinary teams to ensure comprehensive care. This might be with the respiratory therapist or the physician. Hi, my name is Jocelyn. I'm going to be going over the conclusion. So sleep is definitely essential to our overall functioning and health. Too much or too little can definitely have an impact on the quality of life or your health. OSA does affect the quality of sleep and it can lead to serious health risks. The CPAP is the most common and effective treatment for patients, but we can also use surgical options such as the MMA or respiratory therapies such as deep breathing exercises. It's very important that the patient is adherent to the treatment to make sure that there's no further decline in health and that the patient is treating this cause correctly. Many patients do have a lack of knowledge, so as nurses, it is our role to educate them and make sure that they're using the equipment properly. The personalized equipment is essential because it can directly lead to better treatment outcomes for these patients. Hi, my name.
And finally, these are our references we used to achieve this project. Thank you everybody for taking the time to listen to our presentation. Please let us know if you have any questions or comments down on the discussion board. Thank you everyone.